Keir Starmer sat in that chair not so very long ago and told the story of his very sick mother in intensive care. He said to me, it's touch and go. She held my hand and she said, you won't let your dad go private, will you? As a former NHS nurse, that sense that going private was a betrayal. You're saying Labour can't afford to have that view?
I feel viscerally in my heart the same. And my approach to private health is the same as private education and private schools. I don't like it. I don't like the fact that people have to pay for what they see to be a better experience. But I'm also pragmatic enough. And so my head kicks in over my heart to say, well, we're not going to abolish private schools and we're not going to abolish private health. You'd spend a huge amount of time, money and legal battles trying to do something that doesn't actually make anyone's experience better. My ambition as health secretary will be to make the NHS so good that people don't have to go private.
Now, Dr. Bob Gill, are you there?
Yep. Can you hear me?
I can, yeah. Now, what I got from that was, firstly, he said that Labour had to go to the private sector before to make the NHS work. So he was sort of saying that was acceptable, what happened before. I took that as something. But is he just being stupid about thinking that you can work with the private sector and it won't undermine the NHS?
Well, what he's doing is signalling to private healthcare investors that New Labour, back in the control of Starmer, is a safe pair of hands. He's recycling the contrick that Alan Milburn pulled off back in 2000 with their concordat with the private sector. So we now have a private healthcare system which is hooked on work that the NHS pays for them to do. Something like over 500,000 elective procedures were done by private hospitals, paid for by the taxpayer. But what Wes Streeting isn't telling us is that the things that need to be done to stop NHS capacity falling are stop bed closures, is to reverse the shrinking in capacity that occurred during the pandemic, and stop staff leaving the NHS. Now, I don't think he addressed any of those points, but what he's doing is doubling down on a failed strategy. Because when Alan Milburn did his concordat with the private sector, for the first time in NHS history, they outsourced clinical services. And what has happened since? This was not a temporary solution. The private sector activity paid for by the taxpayer has expanded. So this is another trick. Although he put on a good performance and he suggested that his heart was with the NHS, well, you know, we've seen all this before. What he's reinstating is their belief in public-private partnership. Well, let me remind you of the success of public-private partnership. Let's take private finance initiative. That has saddled the NHS with toxic debt liability, and it's one of the main reasons we haven't got enough beds in the NHS. For every PFI hospital that was built, they closed 2 hospitals. So although the hospital building program was necessary, it was in fact the biggest covert bed closure program, and also a financial mechanism to saddle the NHS with debt so that more and more money is sucked out of the system away from the delivery of care. So Wes Streeting is pulling off yet another contrick. And if anybody's in any doubt that Labour under the current leadership has any belief in public health provision, they need to think again.
So he's effectively saying it's desperate times require desperate measures. Therefore, we need to work with private sector, and it's a narrative that they're going to push, isn't it, over and over again?
Yeah, and it's superficially appealing. You know, who could argue we're in desperate times? But what he isn't saying is there is an ongoing bed closure program. Don't you think that should stop first? There are hospitals up and down the country who are losing their A&E departments, and with that, they lose their acute beds. But the timing is also interesting. So earlier on in the week, we had a BBC News section talking about the waiting list growing. Then we had Jeremy Hunt, who oversaw the bed closures, who oversaw the lack of preparedness for the pandemic, commenting on we need radical solutions. And then we had an interview with a surgeon suggesting we build standalone elective surgery centres. Now, who do you think will be running those standalone surgery centres that the public will be subsidising? It will be the private sector. A day or so later, you have Wes Streeting endorsing exactly the same policy. So he is right. The Conservatives are the bad cop of neoliberalism, and New Labour are the good cop. But the direction of travel is the same, to make sure that nearly every activity in society is provided by the private sector so they can extract profit. And in the end, the NHS just becomes a logo and a funding stream. That is the intent. So, you know, the public do care about who provides the service if they only understood that this can be done by cutting corners to maximize profit by employing the fewest staff, the lowest qualified staff, and ignoring or avoiding complex care. They want straightforward care. This is called cherry picking. They want the straightforward, easy operations that they will siphon away and either leave complex patients untreated or leave them within the NHS, which is withering on the vine.
Wow, so this is a bit depressing. But do you think Wes Streeting's preferable to Ashworth? Who's your favourite?
No, I think they're cut from the same cloth. What they should be doing now is shouting from the rooftops that the current health and care bill is legal change to the NHS, which will in effect hand over control of the budgets to an American insurance giant. None of them are saying that. That is the elephant in the room. We're having this distraction. The pandemic is providing great cover for further privatization, and Labour are joining in the contrick. They haven't learnt any lessons from the 100,000 plus preventable deaths. That seems to be a price worth paying for their continued ideological devotion to the market, and it's utterly disgusting.
Well, thank you. Thank you for waiting to come on as well. Thank you for your patience. Great to speak to you again. We'll have to speak again. Thanks.